Quality management, that's what we'll be doing today. I'll go over 11 non-clinical practice questions and the rationales with it. So let's get into it. Hold up. So before I get into today's video, actually, I did a previous video on comparison of quality management, evidence-based practice, and nursing research. Check that video out if you need help with answering these questions. So here we go. Question number 1. To improve quality and productivity, a specialty trauma center is implementing Plan, Do, Study, Act concept. Which quality assurance program should the PMHNP identify as being attempted by the organization? A. Total Quality Management. B. Lean Six Sigma. C. Quality Management. D. Continuous Quality Improvement. Pause the video if you have to, and if you're ready, the correct answer is Total Quality Management. Total Quality Management uses a PDSA approach of Plan, Do, Study, Act. So in this question, I do want you to focus on the keywords. The keywords are improve quality and productivity, implementing the Plan, Do, Study, Act concept. In the question, it says quality assurance, identify as being attempted by the organization. Those are your keywords. So off the bat, when you look at the answer choices, you know you're not going to use Lean Six Sigma. It's not really applicable. In the previous video, if you have watched it, you would know that we use quality management, quality improvement, we use the PDSA method, right? So that's already given. Now it's asking for what kind of quality, especially for the organization. You would do a total quality management. It's not just quality management, it's going to be a total quality management. You want to check broader picture, everything, right? So that's why you're going to do total quality management. Quality management is more of a concept than a plan. Continuous quality improvement is a system organized program. So that's the difference between the three different quality, total quality management, and continuous quality improvement. Lean Six Sigma combines the strategies of Six Sigma, such as define, measure, analyze, improve, control, or it would use define, measure, analyze, design, verify method. Those are what's used for Six Sigma. Question number 2. To improve patient satisfaction on the unit, the nursing team is employing total quality management approach. Which method should the PMHNP use to organize their efforts? A. Define, measure, analyze, improve, control. B. Continuous quality improvement plan. C. Plan, Do, Study, Act. D. Define, measure, analyze, design, verify. If you're ready, the correct answer is Plan, Do, Study, Act. Let's look at the keywords on here. The keywords are to improve patient satisfaction. Also, the other keyword is quality management. Now remember, I had said previously, quality management, when we think or see the term quality management, you should automatically think PDSA. That's really what we use, Plan, Do, Study, Act. And here you can see that is what's the type of approach we'll be using to organize their efforts. And define, measure, analyze, improve, control, or define, measure, analyze, design, verify. Those are your Six Sigma methods. So we wouldn't be using that. So that's why our correct answer is C, Plan, Do, Study, Act. So let's do question number 3. The PMHNP is the project manager for a 12-month quality improvement project that includes multiple activities and stages of development. The best way to illustrate the sequence of tasks is to create a Q&A report, B, program evaluation and review technique flowchart, C, narrative explanation, D, decision-making grid. Pause the video if you have to, and the correct answer is B, program evaluation and review technique flowchart. That's the correct answer because the PMHNP is the project manager for a quality improvement, right? And that requires multiple activities and stages of development over a 12-month period. Those are your keywords. And so the best method for illustrating this is going to be something that uses a sequence of tasks, and you would see that in the review technique flowchart, which is also known as PERT. The events are ordered, The activities are supporting those events are coded from A to Z, and durations are assigned to each event. And a flow chart helps to see visually and represent the project flow from the beginning to an end. So that's why that is the correct answer. Question number 4. The PMHNP has informational, decisional, and interpersonal responsibilities as a nurse manager. Here's an example of a decisional responsibility. A. Disseminating policies. B. Conflict negotiations. C. Serving as a spokesperson. D. Allocation of resources. If you're ready, the correct answer is D, allocation of resources. So when we look at this question, you need to note what are the keywords. The keywords are responsibilities as a nurse manager, and what the question is asking is an example of decisional responsibility. So what is decisional responsibilities? Decisional responsibilities include things like allocation of resources, where you're making a decision, right? Employee evaluations, hiring and firing, staff members. Yeah, those all include making a decision. Informational responsibilities are like serving as a spokesperson, monitoring staff activities, or even disseminating information. That is considered informational responsibility. What is interpersonal responsibility? Interpersonal responsibility is going to be like there's a conflict resolution, you're negotiating, networking, staff development, and provisions of rewards, such as your salaries and punishments. Those are interpersonal responsibilities, okay? Great. Question number 5. The PMHNP is involved in a quality improvement project at the hospital. The nurse practitioner colleagues' charts are reviewed 4 times per month by the nurse practitioner to ensure diabetes protocols are followed. This method is A. Core competency. B. Force field analysis. C. Peer review. D. Risk analysis. Pause the video if you have to, and the correct answer is peer review. So the keyword in this question is colleagues' charts are reviewed. Another nurse practitioner reviews another nurse practitioner's charts and reviews them for her or him, and that is called peer review, right? That is your peer and you're reviewing their charts. And when you do that, you're going to be respectful and honest with them, and you're reflecting on their work. Question number 6. To improve the quality of clinical practice, the PMHNP A. Charges a fee for patient who arrive late to clinic appointments. B. Disseminates research study results to colleagues. C. Expresses opinions about alternative therapies with patients who consider such treatment. D. Schedules time during clinic hours to meet with pharmaceutical representatives. Pause the video if you have to, and the correct answer is B. Disseminates research study results to colleagues. So the key word of this question is improve the quality, especially of the clinical practice. So let's look at answer choice A. A says charges a fee for patient who arrive late to the clinic appointments. Is that improving quality? You think you might be improving quality with that, but technically speaking, that is almost like turn off for the patients because the patient is late. Now you're charging a fee. That is not going to improve the clinical practice. Answer choice B is the correct answer. We said C expresses opinions about alternative therapies with patients who consider such treatment. So this answer choice is wrong because you're not going to be expressing your opinion, especially to a patient. You're going to give them alternatives, but it's not based on your opinion. Answer choice D schedules time during clinic hours to meet with pharmaceutical representatives. This you might be doing in between break time, in between patient, but it's not going to help improve the quality of clinical practice. So that's wrong. Question number 7, the process of combining the best research evidence with clinical expertise as well as client needs and values is known as A. Research utilization. B. Evidence-based practice. C. Research. D. Quality improvement. Pause the video if you have to, and the correct answer is evidence-based practice. Honestly, the question is asking you best research evidence. Keyword from the question is typically or most likely would be in your answer choices, so note that. You should know evidence-based practice is a problem-solving approach that uses the best evidence in making decisions about the patient care and takes into account their needs, clients' needs, their values, and their clinical expertise. But it may not be generalized beyond the immediate problem. Research utilization, on the other hand, is a process where you're synthesizing, you're disseminating research-generated knowledge, and to make a change in the care. Research is the systematic, empirical inquiry of research among variables. So that is a no answer. Quality improvement is a systematic approach to the analysis of current practice, efficiency, outcomes, and benchmarks. So those are the differences. Previously, I made a video on test-taking strategies where I talk about the top 10 PMHNP test-taking strategies. Go ahead and watch that to help you answer these questions. Question number 8, the process of synthesizing, disseminating, and applying research-generated knowledge to effect change in practice is referred to as A, research utilization, B, evidence-based practice, C, research, D, quality improvement. Pause the video if you have to, and the correct answer is A, research utilization. This is exactly the definition of what research utilization is. It's a process of synthesizing, disseminating, and applying the research-generated knowledge to the practice to make a change. Question number 9, all of the following are components of research utilization except A, critique of the literature, B, synthesize findings, C, applying the findings, D, randomizing the sample. If you're ready, the correct answer is D, randomizing the sample. So randomizing the sample is a component of certain types of research. Critique and literature synthesis and applying the findings are components of research utilization. Okay, we're almost there. Question number 10. The first step in implementing an evidence-based practice is to A, identify the patient population and problem, B, identify key shareholders, C, obtain institutional review board approval, D, review the literature. And if you're ready, the correct answer is A, identify the patient population and problem. This is the first step in implementing an evidence-based practice change, okay? And identifying stakeholders, obtaining institutional review board approval, and reviewing the literature are subsequent steps, okay? Great. Last question. Okay, here we go. Question number 11. All of the following are methods of dissemination of findings except A, presenting at conferences, B, publishing in peer-reviewed journals, C, poster presentation, D, oral defense to your committee. And if you're ready, the correct answer is D, oral defense to your committee is not a method of dissemination, but rather peer review. Presenting at conferences, publishing, and poster presentation, these are all examples of dissemination. I hope this video was helpful for you guys. I hope this helped you answer some questions you may have on quality improvement or dissemination. Comment below, let me know what your thoughts are. Let me know what kind of questions you would like for me to do next. Until next time, good luck studying.